Welcome to Crouse Hospital School of Nursing Lab. The following is a demonstration of the validation skill transfer from bed to chair and bed to stretcher. First, bed to chair. Wash your hands before entering the patient's room. Introduce yourself to your patient and explain that you will be getting them out of bed to the chair. Check the name and patient ID number with the order sheet and verify the order. Read out loud the name and number and compare the ID with the order sheet. Ask the patient to state their full name. Provide for privacy. Follow safety practices. Check that the wheels on your bed are all in the locked position. You will need to check all wheels for this. Pull the chair or the wheelchair next to the bed. Take off or swing away the footrests. Now check the strength of your patient's hands and feet. Use the right hand to right hand technique by crossing your arms and ask the patient to squeeze your hands to assess the amount of strength in the upper extremities. Note a change in side to side. To assess the strength of the lower extremities, ask the patient to push down on your hands as if they were pushing the accelerator of a car. Note any difference in strength comparing side to side. This assessment will help you determine if one side is weaker than the other. Position the chair on the patient's strong side so that the patient can grab for the chair with their strong arm and move to their strong side. Lock the chair. Put on the patient's shoes or slippers to provide a strong base of support when they stand up. Put the side rail down on the side that you will be working on. If the patient is able, instruct them to move their hips toward the edge of the bed as you guide them. If they are unable, utilize the pad to pull their hips toward the edge of the bed. Ask the patient to scoop their hips toward you and assist with the use of the pad or draw sheet if necessary. Raise the head of the bed to a sitting position, 30 to 45 degrees. Instruct the patient to move their leg over the side of the bed while you guide the other leg to the edge. Support the patient's shoulders and bring them to a sitting position, guiding their legs over the edge of the bed. With the patient in the dangling position, ask them how they are doing. Ask if they feel lightheaded or dizzy, and make sure both of their feet are flat on the floor. This also provides a strong base of support. Reach around under the patient's arms and grasp the patient's waistband or belt area or transfer belt. Instruct the patient to reach up on the nurse's shoulder and place the weaker arm up there for them. Instruct the patient that you will rock them back and forth, and that on the count of 3 you will stand them up. Instruct the patient to reach with their strong hand to the farthest arm of the chair and pivot them around. Instruct the patient to feel for the back of the chair with their legs. Allow the patient to sit down as you help lower them into the chair. Remember to use proper body mechanics during the patient transfer. Bend knees and utilize thigh muscles. Instruct the patient that you're going to stand up now. On the count of 3, 1, 2, 3, stand. Reach for the farthest arm of the chair. Move back until you feel the chair on the back of your legs. When they feel it, let them know it is okay to sit down. Instruct the patient, adjust the patient in the chair for functional body alignment. Place the footrests on the wheelchair if necessary, or push them back into position. Support a weaker arm on a pillow if necessary. Always face the patient toward the front of the room, toward activity, and make sure the call bell is in reach. Lock the wheelchair. Let the patient know that someone will be down to take them where they are going. Wash or squirt your hands with gel and document. Now the skill validation for bed to stretcher. Wash your hands before entering the patient's room and provide for privacy. Introduce yourself to your patient and explain what you will be doing. Check the name and patient ID number with the order sheet and verify the order. Read and compare ID name and number out loud and ask the patient their full name. Follow all safety practices. Make sure that the wheels on the bed are all locked. This ensures that the bed will not roll away when you are performing the transfer. Check the strength of the patient's hands and feet. Use the right hand to right hand technique by crossing your arms and ask the patient to squeeze your hands to assess the amount of strength in the upper extremities. Note a change from side to side. To assess the strength of the lower extremities, ask the patient to push down on your hands as if they were pushing the accelerator of a car. Note any difference in strength comparing side to side. This assessment will help you determine if one side is weaker than the other. Pull the stretcher near the bed. And call for some help. You will need 2 to 3 assists for this transfer. Position the stretcher next to the bed with the head of the stretcher at the head of the bed, and adjust the height of the bed so the bed is slightly higher than the stretcher. Lock the wheels on the stretcher and lower the head of the bed even with the stretcher. Again, make sure that the stretcher wheels are locked. With the stretcher in place, put the side rail down on the side that you will be working on. If the patient is able, instruct them to move their hips and body toward the edge of the bed as you guide them. If they cannot, utilize the pad to pull their hips toward the edge of the bed. Roll the patient away from you, keeping the opposite side rail up. Place the slide board under the patient and bottom sheet, making a bridge between the bed and the stretcher. Have the patient roll back and position them on the sheet. And put the other side rail down. Using the sheet, instruct the helpers that on the count of 3 you will slide the patient over the slide board to the stretcher. It may be necessary for the 2 assists on the opposite side of the bed to get onto the bed to help with the move. It is never appropriate to get onto the stretcher to help move a patient. Instruct the patient that you will slide them over on the count of 3. 1, 2, 3, and slide them over. Instruct the patient to move their chin to their chest. Once the patient is transferred over, leave the transfer board on the patient's bed. Assess patient's comfort and tolerance of the transfer. You may ask patient if they are feeling okay, but remember that dizziness can result from orthostatic hypotension that can occur when changing positions from lying to sitting, as in the chair to bed validation, and not necessarily when moving the patient on the same plane as from the bed to the stretcher. Pull up the side rails on the stretcher, assess patient body alignment, cover the patient with a sheet or bath blanket, and raise the head of the stretcher according to the patient comfort and tolerance. Unlock the brakes if the patient is to be moved immediately, and if transport is coming, leave the brakes locked until transfer. Assess the patient's comfort and body alignment and instruct them that they will be there soon, and place the call bell in reach. Wash or squirt your hands with hand gel.